Daniela Faykoo-Martinez is a registered dietitian and is currently the patient education specialist at SeamlessMD, where she designs surgical digital care plans for patients. Daniela has a Bachelor of Applied Science in Nutrition and Food and a Master's of Health Science and Nutrition Communication from Ryerson University. Through her own experience navigating the healthcare system with her family, Daniela knows how overwhelming medical information can be for patients and believes that repeating key messages in different forms of communication is vitally important. As a dietitian in the health tech industry, Daniela enjoys applying her clinical skills and incorporating concepts such as plain language, health behavior theories, and facilitation skills to manage project teams. Her favorite part of the role is reading patients' feedback and being able to make a meaningful, measured difference in guiding patients to a safer recovery. This is Daniela's second episode on the SeamlessMD podcast. Her first episode was episode number 12 on using digital patient engagement for colorectal surgery. If you're interested in anything to do with colons, go check that episode out. It covers a lot about the importance of designing digital patient engagement unique for colorectal patients and covers important topics like bowel prep. Today, we're super excited to have Daniela here again, this time to share more on using digital patient engagement for urology surgery. Daniela, welcome back to the show.
Yay, thanks for having me, guys.
Hey, thanks, Daniela. And also, I want to start by setting the record straight. So just to confirm, Daniela, you were the one who asked to come back on the podcast because you had such a great time the first time. Is that true?
Sure.
I'm not convinced.
Yeah, that's not a very convincing answer. Daniela specifically said, I would love to do a podcast episode again, and this time on urology surgery. That was direct from
It wasn't
Daniela.
that bad. If you need me again, I'll help out.
Amazing.
I'll take it.
So Daniela, we are super excited to have you on the show today. This time talking about urology surgery, which as you know, is very different than colorectal. And so there's obviously unique topics and unique concerns that patients have. For folks that don't know, before we design any digital care plan or any digital program on SeamlessMD, we interview patients who have gone through the surgery beforehand, so we understand different topics and different concerns that were particularly important for these patients. And so for a urology surgery program, we did the same thing. And so Daniela has actually interviewed patients for urology surgery to understand what are unique topics and concerns that are valuable to those patients. Daniela, would you be able to speak to some of the unique topics that patients have mentioned for urology?
Yeah, for sure. So our urology program is one of our newer programs at Seamless. So interviewing patients and getting to know some of their concerns is one of the most important first steps that we do. And right now our urology program consists of prostatectomy and cystectomy surgeries. So when talking to our prostatectomy patients, often this is, I would say, on the simpler side of recovery compared to our cystectomies, and patients don't really stay long in hospital. So actually a lot of the concerns were, I'm going to go home right after surgery, or maybe the next day after surgery. How am I going to take care of myself? What am I going to do? So helping patients identify, maybe you need a support person, or the reason why you're going home so quickly after surgery is, so that you can move more, so that you don't get an infection in the hospital. And I think the more and more we see ERAS being implemented amongst surgeries, this is a common concern amongst patients, but it was pretty prominent with our prostatectomies.
Yeah, let me ask you, so for prostatectomies, I mean, for folks who are unaware, so this is a male surgery, right? Because only men have a prostate. And so this is one of our unique programs where only one sex has this surgery. Did you find there was any difference in like the patient needs, given that we were only catering towards men having recovery with this?
Yeah, absolutely. I think one of the most common concerns that this patient population had was dealing with sexual health after surgery and incontinence. So things like dealing with erectile dysfunction, or, will I be able to orgasm? So often when patients get their prostate removed, they also get their seminal vesicles removed. So I think that was a big topic that we certainly addressed through education, but also in asking them questions and collecting PROs about that kind of stuff. And we also have something called like a caregiver sign up. So a lot of men end up signing up their wives on the program as their caregiver, and sometimes their wife or a female was kind of like their health caregiver at home. So basically, if you sign someone up with you, they can follow along your journey, have access to all the same education. You know, if you're not feeling well, they can even fill out your surveys for you. So it's something like additional that we have. We offer all our patients and all our programs, but that maybe the prostatectomy patients really appreciate it.
Yeah, and you know, we can get more into this later, but I think one of the unique things that I've noticed about the urology program is that despite it being, you know, some of the more challenging procedures, we've had really high engagement from patients in this population. And part of me wonders if it's because, you know, I've heard ideas that maybe a lot of male patients aren't typically the type to talk to their physician or nurse or provider, but they might be more willing to engage digitally because they just prefer to do it on their own more. So I'm wondering if you ever had any feedback like that so far with the program from patients saying that they were more satisfied to do this digitally than talk to an actual provider, because men are kind of like that apparently, according to actual research shows that. But I'd love to know if you saw any of that data so far.
Yeah, that's actually really interesting. I did notice specifically for the prostatectomy program, yeah, really high engagement. They really like to answer all the survey questions, which is great. And I guess it does ask them a lot of kind of like those mental health questions, like how are you feeling today? But also, you know, a lot of people get embarrassed talking about sexual health issues. So I think it's kind of nice to have that opportunity to just answer the questions online and not have to do it face to face. Sometimes it's hard to admit those things. And then ask for help or look for answers. So I feel like the internet and specifically Seamless is like an easy route to do that.
So kind of on a related side note, Al, I hope you don't mind me like digressing for a little bit.
Yeah.
You know, even before we started SeamlessMD, like probably about a year before Seamless, I was looking to like another type of idea, which is kind of similar. So with some other, you know, friends I had, we were thinking about starting a company where we would build an application that a patient would basically complete an electronic medical history ahead of their doctor's visit. So if they would come in with a main issue, and then they would fill out this whole like intelligent, you know, questionnaire ahead of time. And then the physician would actually have all the information before the visit. And so the hope was that would streamline the actual visit. We didn't end up, you know, actually, I think, continuing that company beyond a few months, but I did a lot of research at the time on what they called like computerized medical histories and things like that. And there actually was a lot of data that showed that a lot of times patients would be more willing to answer certain questions electronically, especially around sensitive questions such as, you know, sexual dysfunction or, you know, mental health, because like being in the room telling a provider was sometimes intimidating or embarrassing for certain health topics. So, you know, given that kind of background, apparently there's quite a bit in the literature. It's actually not that surprising to hear that for topics that you mentioned, Daniela, for certain men, like they might feel more comfortable reporting those issues on Seamless versus having to talk to a urologist and, you know, talking about those, you know, sexual dysfunction or whatnot issues. That kind of makes a lot of sense.
It does make a lot of sense, especially like some people who prefer to have the same sex doctor and then they don't. They're probably even that much more uncomfortable talking about it. Yeah. So that kind of mitigates some of those barriers.
And I imagine a kind of related is that you probably have a lot more of these sensitive topics in the educational library too, which I'm guessing maybe a lot of men would not necessarily want to pick up the phone and call the office about some of these issues, but then you're kind of preempting it. Could you maybe share about kind of, is that how you're doing? Are you preempting some of these sensitive topics in the application for men, or what does that look like?
Yeah, something that, you know, maybe someone doesn't want to ask is, will I be able to orgasm if I can't ejaculate? So that like a topic like that, like we just put the information, boom, in your face. You know, this is all the information you need to know about orgasming after surgery, about erectile dysfunction. We also do things like helping patients understand when they can return to some form of sexual activity. So just helping them identify, you know, what that timeline might look like.
That's perfect. Daniela, you mentioned so far about, you know, education and these patient-reported outcome surveys and some of the questions that you're asking patients, and then providing some of these educational responses to them so they understand, you know, things around their sexual health and the recovery period and things like that. Are there any unique topics to urology that you had to design differently in terms of some of these surveys, for instance, or the specifics of the education that you had to put in that really helped patients navigate some of the challenges they might experience while recovering?
For sure. For our cystectomy patients, there's two main procedures that, or urinary diversions that patients experience. And those are either they get a neo-bladder after surgery or they get an ileal conduit. And each of those urinary diversions have very specific kind of tasks and ways to care for those procedures after surgery. So there's a lot of education around what to do if you have a neo-bladder. So for example, a neo-bladder would go home, a patient with a neo-bladder would go home with a catheter. And they would use this catheter, they would learn how to clean it, how to empty it, how to look for signs of blockages and things like that. And then after a while, they would take the catheter out and they'd actually have to learn how to pee again. So a neo-bladder is when a surgeon removes your bladder because it has cancer, and then they'll actually kind of make you like a new one out of your intestine. So they make you like this new bladder pouch, they put it in, and they connect it to a catheter for a while. And then they take the catheter out and you have to learn how to like squeeze your pelvic floor muscles to push the pee out. You have to do a lot of continence training. So very, very complicated. And we have education about catheter, peeing, how to do like a pee schedule, kind of not to infantilize them, but when you're training a kid to potty training, you have them on a schedule. You have to do the same thing when you yourself are learning how to pee again. So there's things like that. And then of course, patients also go home sometimes with a JP drain. So again, learning how to take care of that drain, learning for signs of infection, all sorts of education around their like medical devices.
And Daniela, in terms of like how we deliver that education to make it easier for patients or more timely, so I guess normally the patient might get maybe like a booklet, and then maybe there's some teaching at discharge like one time before they go home. Is Seamless doing anything in particular? Like, are we sending certain prompts about these specific topics with the catheter or the training or something else?
Yeah, so cystectomies do tend to stay in hospital for a couple of days. So while they're in the hospital, we go through a couple of questions like, how much pain, how much nausea are you having today? But we also ask them, are you learning how to take care of your new device you're using? So if someone's going home with a catheter, are you learning how to take care of that in hospital? Do you have everything you need? And then once they go home, we like to say that we give patients bite-sized pieces of information. So once they're discharged, one day we'll send them, this is how you take care of your JP drain. And we give them all the information. And then the next day we say, okay, you have a catheter. This is how you take care of your catheter. Typically what hospitals do is they give you one big booklet with all the possibilities, all the devices, like everything you need to know about all the surgeries. But we make sure that, neo-bladder patients only get information specific to them. The other cystectomy surgery we do is the ileal conduit, and those people have a urostomy. So I don't want to be sending neo-bladder patients urostomy information. So we really tailor the specific information, and then we send it out in like little chunks. And if patients aren't able to or don't end up seeing that education, we also have our daily health check. So once they go home, we end up asking them questions, how are you managing? Are there any issues? And we kind of list them out, and then patients click off the issues that they're having. And if they're not having any, then they see that they don't have any, and that's also kind of nice.
It's funny, like as you're describing that, it makes me think about like other parts of my life where I might get a manual to do something the same way a patient might get a patient manual. And to be honest, I don't often read the full manual. I mean, I just got this new, like my family got me this gift. It was a new, an Nespresso machine. And you get this like big manual, and I'll read like the first page, which tells you how to, turn it on, set it up. I don't read the whole manual. And I know that's different from like having a big surgery and recovering. I probably would read more if I had a surgery or something like that. But to be honest, I mean, Alan, I'd love to get your take on this too as a patient. I don't think I'd read, a 10, 20, 50 page manual. And I think what I would do often, I think a lot of patients do this, is when something bad happens, then I pick up the manual. I'm like, okay, how do I troubleshoot this issue I'm having? But it sounds like what's nice about Seamless is that we're kind of like preempting a lot of that stuff. You're checking in on them. You're asking them how their pain is, or issues with their catheter or their stoma. And then hopefully, because you're prompting them to actually like record something, you're finding out earlier on if something's going wrong, and they're not kind of like picking up the manual or calling the hospital or going back in, when something is going wrong. And it seems like a very obvious thing, but I think it's actually a pretty common patient experience where you only pick up the manual when something's going wrong.
Wrong. Yeah, that's so true. I think that's why we like to send information before surgery, so they have all of that kind of there and they can read into it, if they want. But also we send it again after surgery when they actually need it. So that's kind of like in a timely manner, we would say. And especially for cystectomies, like UTI is huge. And often it causes readmission. It's a really big issue. So helping patients identify, like, oh, do you have a fever? Do you have like this weird pain in the back, like near where your kidneys are? Those are kind of key indicators. Helping patients identify that ahead of time. Really, they can call their surgery team before it gets really bad.
That's a really good point, Danielle, because I think a lot of times, like so that pain would probably happen like somewhere like in their abdomen, maybe a bit more on the side. But then as a patient, you're not necessarily thinking about your kidneys. Like you might think, oh, I just had a surgery somewhere else in the body, but I'm not really thinking about pain in that area. That's probably like abdominal pain. It's probably not related to my surgery, but you don't know. Sometimes it is, right? And that's the point, I guess. I think you also mentioned like dehydration is often an issue. Like I guess what do we sort of do to help track that on the platform?
For sure. So in addition to education and kind of reminders about make sure you drink 9 to 12 cups a day, we also do things like asking patients to track how much they're drinking. So the urology team that we ended up working with on Seamless, they were super adamant about getting patients to either like get cool devices or get like water tracking apps so you can kind of record your volume. So we really encourage patients to do that either through another app or even we have it on our own program. So whatever patients prefer. And then we also help patients identify signs of dehydration. So for example, dry lips, dry skin, maybe you don't have any pee output, things like that, just helping them understand, you could be dehydrated, you're not drinking enough.
Mm-hmm. I think that's really important because, chronically as a population, we're often dehydrated. And then after a surgery, of course, it's going to be compounded. And I think there's so many people out there that don't know necessarily the signs of what dehydration is. They, or what to look for if they're dehydrated. And so I like the idea that you're prompting patients with, really easy to understand information, like, do you have dry lips or,
dry lips, dry skin, brown pee.
Exactly. Yeah. So and I find like that's a lot easier to digest and it's easier to identify as a patient if you have any of those signs. And then from that, my understanding is that you're then sending them the correct education based on dehydration and to avoid like a readmission, for instance.
Exactly. So the way we call it our daily health check works is we ask a question. We're basically looking for potential problems or complications. If you identify like, this might be something, we ask you more probing questions. And then based on the information you give us, we tell you, hey, you should call your surgery team. This could be a sign of infection, a sign of dehydration, whatever it is. And there's lots of reasons why people can't drink. Maybe, maybe they're nauseous and, there's lots of different reasons. So some of them are more serious and we kind of like tease that information out of patients.
Excellent. In terms of patients who have gone through the urology program on SeamlessMD, have you collected feedback from them? And if so, what are some of the themes that you've noticed and heard from patients?
Yeah, we have lots of fantastic feedback from both our cystectomy and our prostatectomy programs. One of the most awesome things that I've seen, I'm so super happy that patients said this, they were really worried about their pink pee after surgery, and we helped them realize that it's normal. So oftentimes before surgery, someone with bladder cancer will end up peeing blood. And that's one of the indicators you have cancer. So they get out of surgery and they're like, oh my God, there's still blood. So they're probably really concerned. And there shouldn't be bright red blood, but it is normal to have a little bit and that turns your pee pink. So it's one of the things. Something else, some patients really appreciated the repetition of all the pre-surgery instructions. So because we send them out like a little bit, we send them instructions via reminders, sometimes via survey, then they have the opportunity to read the library and like read at their own pace. I really believe repetition of important messages is very important and it helps drive the point home. So I'm really happy to see that a patient picked up on that and it worked for them. This was really nice. One patient didn't know who to call because they had a fever of 101. And they were actually going to go to the emergency room, but after doing the health check, we actually told them to call their surgery team first. And this can be super important because, one, COVID, you don't want everyone going to the hospital, but two, sometimes surgery teams can actually help you kind of jump the ER line and kind of make you a priority. So contacting your surgery team first can actually be a super important step instead of going to the hospital yourself.
That's a great point, because actually there's so many times where some of these issues are related to the surgery. And if you go to, like, say, your local ER, which would have a completely different healthcare team, they have no idea what happened in your surgery. Often they don't even have a urology program, so they don't understand the nuances of how your surgery might have, caused some of these complications. So when you're able to talk to someone on the actual team that did the surgery, you're more likely to get, I think, really like focused, relevant feedback. And it sounds like an obvious thing, but I think very often people just go to their local ER clinic, and like the doctors there or nurses there have no idea like what happened to this patient in the last month even. You might give the wrong feedback, to be honest. And not because they want to, but because they don't have the context.
And especially if you don't go to the same affiliated hospital where you had your surgery, like some patients travel very far to get their surgery, so they go to their local ER.
Right.
That's also why if we do tell patients to go to the ER, we always say, like, tell them to call so-and-so and tell them you had surgery, because they need that information to do a proper assessment.
Right.
Absolutely.
Yeah.
Also, I guess in the back end, the clinical team can then see the responses that the patient received, and they understand that the patient maybe has gone to the ER for the concern. So the surgery team would also kind of have an understanding of what's going on with the patient.
Yeah. If the surgery team decides that they want to be, reviewing in kind of a live, they want to collect information about patients and where they're going and which other healthcare providers they're seeing. If they want to do that in the moment, they can absolutely check up on patients day to day. We have some teams that, really like to do that and see how their patients are doing in real time. And if if clinicians want to take kind of like a backseat and just look at the data later on, they can also see, hey, a lot of my patients ended up going to the ER. A lot of my patients ended up, calling their family doctor for XYZ. So we always ask patients, have you seen any other healthcare providers? Where did you go? And what was your reasoning for it? So that hospital teams can kind of use that information however they please.
Right. I think that's neat as well, because you can then drill down into like, what are the root causes for, the X percentage of patients that are being readmitted, for instance, and you can really easily determine, well, maybe it is dehydration related, or maybe it was because of a UTI, and they can kind of figure that out a lot quicker because that information is all being, pushed through by the patient into the platform.
Exactly. And a lot of the clinical groups that we work with end up using our information, or sometimes join, Seamless, to kind of narrow down, like, what barriers are we having? How can we improve the process? How can we improve the patient experience? A lot of the clinicians we work with actually care about patient satisfaction. So this information that we give them is super useful and helps them pin down, okay, well, patients are having a struggle in this area, so we can address it.
Right.
I think it's a really great point. I sometimes when people, I'm sorry about that. When some people hear about Seamless for the first time or see it for the first time, the impression is, oh, it's just an app for patients. Like, that sounds like a pretty basic, straightforward thing. But it's kind of, Danielle and Alan, you've highlighted, there's so much more to the platform. There's so much, important data coming in. There's so many things they can do with the data to improve the patient experience and their health outcomes. So I think sometimes it's almost as if they have to actually get their feet wet working with us to understand, like, oh my gosh, there's all these little extra things that we kind of keep in the back seat because we don't want to overwhelm them. But once they get their feet wet, they really understand the value of the whole platform, which is pretty exciting.
Yeah, absolutely.
Definitely. So Daniela, at this point, just looking at the time, we're going to jump over to our Fast 5 lightning round questions, where we're going to ask you 5 questions and you can answer them as concisely as you would like.
And Alan, these are brand new questions that Daniela didn't get last time, right? Like, you can't cheat and
Yeah, I'm not giving you the same questions as last time. So, I mean, your answers could stay the exact same, but you'd be answering different questions. So let's not do that. Let's answer these questions today. The first question that we have, Daniela, is, what is something you believe that others in healthcare might think is insane?
I think a lot of healthcare, and some people might agree with me, I don't know, but I really believe that there is a place for non-traditional, non-Western medicine alongside our traditional medical healthcare system. And I really, really, really hope that by the end of my career, I see us come together and work together and figure out what's best for patients. Some people are going to think I'm full of it, but.
And Daniela, just to be clear, you're talking about digital patient engagement.
That is non-traditional.
I just
Yeah, exactly.
I totally agree with you and get your point.
Yeah.
Just adding some marketing there, but I think Ella and I both get what you're getting at in terms of
Totally.
like non-Western traditional medicine.
Yeah, I think we have a long way to go.
Yeah,
for sure.
Second question: how has a failure or apparent failure set you up for later success? And then part 2 of that question: do you have a favorite failure of yours?
This is like an interview question.
Yeah.
This is an interview, by the way.
This is yeah.
I don't divulge anything like too personal, but I'm not going to tell you all my flaws. But I will say, I think one of the failures that set me up for success later on was when it's a bit of a story. So when I was like younger, I would say like about 18, I took an interest in real estate, and I was really into like, I wanted to invest, but obviously you need a lot of money to invest. So by the time I was at kind of like a crossroads in my life, I was thinking, okay, I can continue on doing more school, which will cost more money and time, or I can work full time and invest in real estate, which is what I love and have passion for, whatever. So I actually decided that I was going to pursue more schooling, and I didn't end up working full time to save money to invest. And then 2017 happened, and housing market's like, boo. And I felt like I missed my opportunity, and housing was so unaffordable. So that really felt like a failure to me. And the reason why I say it was a success, because pursuing additional education, I think really set me up for a successful, hopefully, career. And I think that'll really pay off in the long term. And although I didn't invest before we had a housing market boom, I ended up marrying someone who also has an interest in real estate, and that's something that now we're still pursuing together. So I think that if you like really have a passion for something, you'll come back around to it. Worked out.
That's great. Yeah.
Sorry, Alan, go ahead.
Well, I was just going to say, I mean, that's a subjective failure. It wasn't an objective failure. You changed your decision, you decided to go into more schooling, and it seemed to work out in the end. I think that's really great.
It worked out.
I think the other thing too, Danielle, is that like, I think the part of the success here is like just your attitude to it. I mean, you could have just been negative or cynical about it, but you chose to be like, hey, actually, here's like the silver lining over right. Like how your journey kind of changed. And I think that's just going to make you even more successful long term, because you just have that great attitude, honestly.
Thanks, Josh. Thanks, Josh.
Yeah. So you passed the interview. That's it. All right. Question number 3. Would you rather have invisibility or super strength?
I'm a petite person. Obviously, I want super strength. Push things around by myself, not ask for help. Like, that'd be awesome.
Wait. Like super strength.
Yeah, super strength.
Like you're gonna be lifting cars. Like.
Yeah.
I mean,
maybe you wouldn't care to. I don't know.
I don't care about that stuff. I just want to open jars and stuff.
Right. Could like break the jar.
More strength.
Yeah. Slightly more strength. I like that. Question number 4, Daniela. What is your favorite movie?
The Holiday.
The Holiday?
The Holiday, like Cameron Diaz and...
I don't know that one.
You don't know that one?
I don't know that one.
It's a rom-com. But, I'm most people wouldn't understand this. I don't watch things twice. I don't watch movies twice. I don't rewatch shows. I watch it once and I'm done.
Really?
So The Holiday, I will actually watch every single year.
That's the only one that you'll rewatch? Like of everything out there. There's not even another one that you would.
I don't even rewatch Disney movies.
Wow.
Wait, so if someone like you have family around and they're like, hey Daniela, we wanna watch I don't know, some movie that you just
The Lion King or something.
I'm leaving.
Yeah.
I mean I'm not gonna put up a fight, but I probably like won't be interested in watching it. Like I already know what's happening. Why would I watch it again? There's like no suspense. There's no. I don't get why people rewatch stuff.
Deeper understanding. There's maybe a subtextual conversation you didn't understand the first time. I digress. It doesn't matter.
Yeah. What about The Holiday in particular? Is there a part of the movie that you really like in particular?
Yeah, I'm totally obsessed with Christmas. So it's a bit of a Christmas movie. It's also a rom-com, and I don't know. People like it's like 2 girls do a house swap, fall in love, and Christmas. It's just like a feel-good rom-com thing. And there happens to be a really cute guy in it. I mean, that helps.
Wait, that's Jack Black? Or?
I thought you said Jack Black. Yeah, is it Jack Black?
No, the other one.
Well, I mean, Jack Black is pretty cute, but
It's not Jack Black, it's the other one. But I don't
Wait, you can't remember who's the other one? If it's not Jack Black.
Google it? I don't know.
I'm gonna have to watch this movie at some point. The holiday.
I tried watching it.
Looks like. No.
Well, now I have to look it up.
Are you guys Googling? I could've Googled
Yeah,
it.
I'm googling.
Oh, it's Jude Law.
Dude, of course, yeah. All right.
Oh, he's cute. Yeah.
Yeah. I would rewatch that movie. Good point. Yeah. Okay, last question, Daniela. This is right from Tim Ferriss. If you could have a gigantic billboard anywhere with anything on it, so metaphorically speaking, getting a message out to millions or billions of people, what would it say and why?
So I would have to hire a marketing team to figure out what to say. Alan, I'll hire you. But it would have to be something about the environment. Last night, I read something how Canada's trying to sign this deal with Brazil to get cheap beef in Canada. And, it's part of the reason why they're burning down the Amazon. It's causing all those forest fires. It's so upsetting. So I have a deep-rooted passion for the environment, and I want more people to do stuff about it. It's awful. It's really awful.
That's a good message.
Yeah. I don't know what it would say, but, something.
Yeah. Something about beef. Got beef with the environment. Something
That's pretty good.
Sure.
It's a great message, though. Awesome. Well, Daniela, I'm looking at the time. We have to end it here, but I do want to thank you for today being on the show and talking about digital patient engagement for urology. You covered a lot. We talked a lot about the nitty-gritty components that you've built into the platform to really encourage patients and coach them along their way, prevent things like readmissions and spot signs of complications earlier. And so I think definitely our audience will find value in it. And I learned a lot today. And so I just thank you so much for being on the show.
Yeah, no problem. Thanks so much for having me.
Thanks, Daniela. And Alan, we'll make sure to @Jack Black on Twitter. And
Jude Law, yeah. Also,
yeah.
Daniela, you did pass this interview, so if you'd like to return for another episode, we'd probably allow that to happen.
Right,
so
I'll think about it.
We'll think about it too.
A mutual decision. Amazing. Thank you so much, Daniela. Have a great day.
You too.
Bye.
Yeah.